This is way too general. Don't worry about that. Don't worry about that. It's mostly the ones that are very obvious. The scalenes, the suboccipitals. Yeah, that's,
Do we need
you
to
know.
bother to know all
Well, you know, if it's obvious from spine to transverse process, then you know it's a transverse.
Okay.
Yeah,
Is
yeah.
it rotatory?
Yeah, okay. Yeah, that's, no, now that's going to have to be a multifidus because it's more than one, right? Okay, yeah, don't stress over the scalings are the best on here and the suboccipitals are the best on here.
Which one should we stress on?
Everything else, yeah. In terms of trunk, spine, you should know what's a transverse process. You should know where the body is. You should know where the spinal canal is. You should know where the lamina. Huh?
You should know atlas and the
Atlas and axis. Yes, you should. Yes, you should. You know?
Question.
Okay.
I want to know. I want to refresh a memory about the subtalar measurement in prone.
Okay,
So this
it's subtalar. It's the calcaneus inversion and eversion.
So the movable arm is the calcaneus. The axis is the subtalar joint itself.
That's right.
And the
And the stationary arm is going to be the midline of the tibia.
Okay.
Okay, right.
That's the
Okay.
lumbar.
And actually, I think you have a picture in Lippert with the dotted line that way, don't you?
What about the Q angle?
What about the Q angle?
How do you...
Okay,
You
now
measure
that's
it
not going to
from-
be on
from-
structure,
Okay.
Yeah,
but
from
you know,
ASIS
maybe
to
on
the
the exam.
pattern.
I mean, you need to now. You know, there's not going to be a whole lot of focus on it because we're going to do a lot more in the orthopedics in the spring. You know, you're going to have a sort of a mini course on that. We'll talk a little bit more about the Q angle. You know, but you know, we just in general what it is. You know. Okay.
That's the PCL.
Yeah, of course that's the PCL. Okay, well, what do you what attaches up here? Right, so you have a lateral head of the gastroc, okay? And what's this one? That would be the popliteus, okay? And then you should know what these guys are, right? These guys?
Yes.
Okay, okay, all of this, okay?
Wait.
Menisci, okay?
This is patella tendon, right?
Right, that patellar tendon here, quadriceps tendon here. You
Medial
have
collateral.
medial collateral, lateral collateral.
Bring more.
Well, you know this.
we need you.
Okay.
We need you.
Oh, the nerve.
It's not. Is this the dorsalis pedis? That
Is
right
that
there?
yes, that is
Yeah,
an
it's right.
artery. That
Okay.
would be the dorsalis pedis artery.
And
Right.
the thumb and dick.
And remember, these are the
You
tendons.
see, you know it
okay?
already.
Anterior tendons. You have your extensor hallucis longus, you know, which is here. Extensor digitorum longus, which is here. And then where's Bernard, okay? Was it Bernard? No, who was it who was having, oh no, it was Sean that I told to look at
No,
this again
that-
for the
that might be
extensor
Kedrick.
digitorum brevis. That's this one just going to the lesser toes, okay? And then look, lateral, so you should know, the one going closest to the malleolus, that's going to be the brevis. Longest is, look, it's going under, right? Huh?
Yeah, there's a digitiminimi down there, but we didn't cover it. Yeah. Yes. Yes. In the intrinsics. Yeah.
But you say this is the Tom, D, R.
This is Tom. Tom is going to be the first one. Okay, now Tom does go over more, and this guy goes over more like this.
This one is the brevis
Dick
and
is-
this one is.
and then
What
Harry.
is the tortious in here?
Huh?
Tortious.
The tertius is this one. See, that's the tertius.
Okay. Anything else? Guys, come on.
What are these guys? I mean, I know this was. But what is that? What was that?
Sarosi. Those are interruption.
Yeah, of course, it's like the hand. It's like the hand.
But we don't need it.
No, you don't need to. Oh, no, who pulled these nerves all the way out? They should be. See? They got pulled out because this belongs all the way inside.
We don't need to.
Well, we're going to stick it in.
Bella.
It's okay. We don't need to. We
We
don't need to fool with those. We're just going to put that inside.
We
Now,
have more.
don't wreck the models.
Okay.
Okay.
Because we need these tomorrow.
Yes, we need them tomorrow.
These exact ones.
Yes.
Bella, bring that one. No, the
Drumstick.
yes.
Drumstick.
The drumstick. So what's good on here?
So Yeah.
That's
Let's-
affecting.
There's the obturator antennas.
Well, it is, and you see how it goes. You
Yeah.
see?
What is it? Glomerular superior.
Probably, yeah. But you know, this isn't the best, so
Yeah,
therefore
so
that's
that we
not
shouldn't
going to
bother
be
about it.
right. Don't stress about that. And this one would be
the
that would be
piriformis.
piriformis, going from the sacrum all the way over to the greater trochanter,
just the-
and what attaches to the greater trochanter.
Medius and
Medius
minimus.
and minimus, and which one's a little more in front?
Medius.
Minimus is in
Attachment,
front?
the attachment on the greater
Ah.
trochanter.
Oh, yeah.
Minimus.
That's
yeah.
why it only
The
internally
antenna
rotates. Okay, look, this is a much wider. This is
right.
medius, this is minimus, this is medius, this is minimus. Okay?
This is minimus and this is
Yeah,
medius.
yeah.
And
So that's why.
the
This
hanging
one at
ones.
front and this one behind. Minimus.
That's why this one doesn't turn out.
These are the.
No, don't worry about these.
Okay.
They're fine. I don't even know what they're-
Yeah, that's muscle.
Because somebody started
But
eating
in
them.
terms of
Bernard was eating them this
osteology,
morning.
look, you can see this part of the sacrum, you can see this part of the sacrum,
Promontory.
you know.
Uh-huh.
This is
Can we go?
That's Allah, right?
Which part?
Where's the Allah?
The
The
wing.
ala are the wings, yeah.
The
that's-
wings.
That's this part.
Then this is the auricular.
That's the auricular. So see, this already is attached, so you can see the inside of the attachment. See, so that's an auricular surface, and there's a corresponding auricular
Auricular
surface
surface
on
on
the
the
pelvis,
pelvis.
and they match.
This is the iliac tuberosity.
Okay. Okay.
Promontory or what is it called?
Promontory is
Where's the more
Yeah,
promontory?
that's a cross section. What can you tell from
Should we
that?
stress on that?
What can you?
Yes,
No,
you
we didn't stress on that. You shouldn't stress on it, but from what you know, I mean, what can you identify right away? Here, we should know that that's
Femur,
a femur. That's the tibia, okay? But this
Patella.
is now this is a
Sagittal.
sagittal section. Okay, so if we're going from the front, okay, that's going to be the patella.
Patella.
So this is going to be
The
patella
rectus
tendon- I'm sorry,
femoris.
quadriceps tendon with the
Rectus.
Rectus
probably
femoris.
the rectus, and then this would be the
Patella
patella
tendon.
tendon, okay? And let's see, what would this most likely be? Sitting on
The
top.
meniscus.
Probably the
Meniscus.
menisci. And do they say that? 'Cause this
Yes,
is-
they
yeah.
said that. No, it says that is the
76,
meniscus,
5, okay.
anterior cruciate
Yeah,
ligament,
meniscus, exactly.
then posterior
Yeah,
cruciate.
right, because again, you're just getting that section, okay? Now, in the back, what do we get to first, okay? Yeah, it should be hamstrings, okay? And how about down here, below the knee?
Gastroc.
Gastroc,
Soleus.
and then soleus, okay? And then what would be your...
Posterior tip.
Tibia, posterior.
Posterior tip.
Interosseous membrane.
Perfect.
Okay.
Posterior tip.
I was going to say, because this is way up high. See, tibialis posterior is a little further down. Yeah. See, so, I mean, this gives you a lot of information. And
Trapezius.
what about this one that's closest to the femur? Okay, we said that would be intermedius, most
Intermedius.
probably. Yeah, so see, you just...
You know.
Here, we get real
because
confident
you're
when you
here.
come
And
around.
this, and this is an artery. Do you see that?
Where?
Sciatic.
No, that's the yellow should be nerve.
No.
This
Tibia.
red, the
Tibia.
red part.
No, it's a popliteal.
Popliteal
Popliteal.
artery. See, when you get to the knee, it's popliteal artery. But anyway, I mean, that's not.
Yeah.
Oh, and these green things, okay?
What is that?
What is
Bursa.
it?
Green usually stands
Bursa.
for a bursa, right?
Hey.
And remember how there are
You
lots
said
of
it, right?
bursae?
I got it on
So if it's behind the patella, it's going to be a subpatellar.
Subpatellar bursa.
And if it's
Bursa.
below, it will be infrapatellar. If it's above, it will be suprapatellar.
Suprapatellar.
You know, so that kind of language. Okay.
Bola.
CCB.
Yeah, be prepared to figure it out. Okay?
Figure.
From what you know, always, if something is tagged, if it's tagged on the muscle, follow it to the tendon of attachment so you can see where it goes and what it does, and that way you're going to know what it is, all right? If it's a tendon, then, look at it. Where does it go? What is its action? You might follow it to the muscle. So make sure, you think about it.
Yeah.
And this, okay?
I didn't give her the ligament.
This part up
You're not
here,
sure,
the
no?
flat,
We
is
should
called the
ask
tibial
her
plateau. Okay, the top is the plateau. And actually, all of this flat. Yes, that's right, and that's the groove, that groove. Okay, and then you have,
Intercondylar groove.
yeah, that little
Okay.
space right in there. See? Okay, so what? This is the popliteal fossa, right? And of course we have our muscles removed, but so it's a diamond, right? Because you have hamstring on both sides, and then you have the medial and lateral gastroc. And in between, just like the femoral triangle, you have the three vessels. We have sciatic nerve, and then it changes to common tibial and common perineal, which is going to go here laterally. Okay, and this one, the tibial continues all the way into the back. Okay, and for innervation, I mean, if you can just see this and think about it, everything in the back is tibial. It's all tibial, okay? And then when you go here, it's going to be
Peroneal.
superficial is in the front. Okay.
Okay.
Lateral
Deep.
is deep.
Deep is
This
in
one is
front,
deep.
superficial is here.
Superficial. Yeah, deep is in the front. Sorry, deep is in the front. Superficial is lateral. Okay, and that way you can figure out the innervations easily.
So this
Artery will be
what-
tibial artery, right?
Well, tibial artery is here, and it's going in the back. Okay, and this is I don't know. It's what's the anterior one? What are they? What did you?
Tibia,
Topic,
because we were
dorsalis
saying that
pedis.
this is dorsalis pedis.
Well, dorsalis pedis down here. Yeah,
Okay.
it changes, but
Anterior tibial
it's
artery.
probably anterior tibial artery. Yeah, well, look at your circulation sheet, and it divide the major divisions. What do you have going below the knee in terms of arteries?
Hey, come on.
Patrick.
Oh, anterior tibial.
Huh? Anterior tibial, see?
Posterior tibial, anterior tibial.
Posterior
Yeah, so-
tibial, anterior tibial. Right here. Yeah, okay, there you go. So it's popliteal
Oh,
here, and
yeah.
then it divides.
So the anterior tibia will form the
Posterior tibial,
dorsal.
anterior tibial, and anterior tibial turns into
Into
the
the
dorsalis
dorsalis
pedis,
pedis.
and the dorsalis pedis is palpable between these two tendons, right here on the
Okay.
top,
Well, the tendons of the hallucis and
Between the
digital.
extensor hallucis longus and the extensor
The
digitorum,
digitorum.
right about here. That's where you can usually
that the-
feel it.
Question.
Natalis.
I think that's all. Where's the
Okay,
celiac?
okay, were you, who was asking me about the thing I posted on Blackboard? Maybe I put this up by mistake. Yeah, no, you didn't, I responded to you, but then was it Bernard, were you asking me to, did you say that this is what was up there?
Yes.
Yes.
Yeah.
Okay,
No,
all right.
I'm sorry.
Okay,
What
I
did you see?
changed it
The sheet.
yesterday.
You
I
changed
guess
it
I must have,
Because it was not there.
I saw
I
it
must have,
yesterday
okay,
night.
so there was some word under assignments, you will,
Is it the splenus capitis?
it could be, it could be,
Okay.
What's the one here?
it could be.
Know everything.
I started to say in terms of trunk and spine, muscle-wise, I mean, it's going to be abdominals, okay, and maybe a couple of the back muscles, but on here it's not very good, okay.
Okay.
These few up here are obvious, and these, but the rest of the I don't worry about.
Those
any
of
it.
you say their names.
Yeah, these are those suboccipital one, and this would be a transverso spinalis. Okay, but the abdominals. Okay, so we've got rectus abdominis. What else do we have? External.
Obliques.
Okay, do we have an internal oblique?
Somewhere there.
Right here.
Damn.
This is part of the exam.
Yeah, and that's the only place you can really. It's not covered. It's not covered.
And
Okay,
the
and then, of course,
transverse.
we're not doing these guys anymore, so
No.
you don't have to worry.
Sit
But
down.
what about the hip?
About
Okay.
this?
We did
Okay,
this today.
yeah.
you know.
So here we
That's
go.
him.
Sternocleidomastoid. Okay, all right.
Levator
And then we have
discus.
scalenes. All right.
Please, what is this one?
Scalene. What is this one?
You don't have to stress about them, but that was part of the spine. That was neck. You didn't get that many muscles, All
That
right.
many? I think we got a good
You
amount.
got a good amount. Okay. All right.
Miss
And then
Nunn.
we have all the hip.
The scalings.
All right.
We have the anterior, posterior, and
Do we have?
where do we
Oh,
have
we
the
didn't- I guess I don't
levator?
have these.
It's on here.
It's on here. Right. That's right. Okay. Yeah, and I might have had it on a big card before too, but let's see, start at 2.2. Yeah, right, well, sternocleidomastoid, that's easy, okay, we have both of these, but the scalenes should be the first ones, right? And, right, 225 is this is the levator. So levator is like last.
Okay.
Levator's last, the scalenes are here, okay, and this is a different omohyoid, we're not worrying about that.
Okay.
So which one is scaling now? Is this one?
This one, no,
This
no, no,
one?
this,
Well, you put
these
your hands
guys,
up.
these
Alright.
guys.
And
yeah.
now the
So
levator.
scapulae, scaling,
Scalenes,
and sternocleidomastoid.
sternocleidomastoid, that's easy.
Okay.
That's an easy one, right.
Transverse-
And then we go to the hip, okay?
That was
We go
quick.
we go to the hip, okay?
Can you go back up, Tam?
So what's this?
Serratus.
Serratus.
Sartorius. Sartorius.
Sartorius, and then we have,
Tensofasciolata.
TFL.
Muscle tension.
okay, anterior
IT
band,
band.
right, IT band. And
Rectus
so, and then
femoris.
Rectus
femoris.
femoris.
Pushing them out of the way.
This one is the lateral.
And also in the back.
Yes.
Oh, it's like Harry.
Yeah, yeah.
That-
Hey,
that has
look
stayed
look
down,
on the other model. You'll see it sticks out on both sides. Both sides.
Wow.
Okay, it's a big one. Okay, all right, and then a little bit of medial. How about up here? How about up here?
Pectineus.
Adductus longus.
Adductor
Longus and
would be
pectineus.
first, and then
brevis.
iliopsoas. Iliopsoas, and this is wait a minute.
That's
No,
pectineus.
I'm sorry. Wait a minute. Okay, adductor longus. Okay, pectineus. Okay, and then a little bit of iliopsoas.
So is that the femoral triangle?
Yeah, that's the femoral triangle.
Triangle. Yeah.
So this would be inguinal ligament. Okay. What about in the back here? Okay, what's cut here?
That's a glute max.
That's glute max. That's glute max. One right here. Okay.
Okay.
And then what's
Medius.
This is medius. And this is
Minimus.
minimus. And then you have your guys here.
Deep
Okay,
rotated.
1, 2, 3, and then you got
Yeah.
your other one in between.
So what
Okay.
nerve is
And
that?
how
The
about
ligaments.
back here? Okay, what is this?
Sciatic.
Sciatic nerve. And what is this?
Sacrotibius.
Sacrotuberous.
Absolutely.
I cannot stick it in my head.
Why? Sacrum to tuberosity. Sacrotuberous.
Tuberous.
I just somehow I
Say
cannot
it.
stick.
Say it. Say it.
Sacrotuberous. I know, but
5
after
times.
after one, I will forget it.
Say it in your sleep. Okay. All right. And then we have what? Hamstrings.
Yeah, the biceps.
And yeah, well, okay. So and but what's going to go? These that are going medially is
So
going to
it's
be
the tendinosus
right,
and
and the biceps is going to be this one probably going out that way. So that's pretty simple too. I mean, that's about it. Right?
Simple to nod.
Yeah, yeah.
Simple for
Not
nod.
simple to know, simple to nod.
To nod.
So we just nod when you say it.
That's the transversus. That's right, because you can see your 3 layers, and it's the only one that goes straight across.
Do you see the internal
Don't worry
oblique here?
about the
Huh?
deep one.
The internal oblique. Are you going to see them from here?
You're only going to see it here.
In the middle.
You're
Okay.
going to see it in the middle. That's it.
Just don't open it.
And this one is
And that's going to, the pectineus is here, that's going to be your iliopsoas coming down. Right, yeah, because this is your femoral triangle, and in the floor of that is going to be your, of course, adductor brevis is underneath, but you're going to get the pectineus.
Okay.
The magnus is really
part
in
of
here.
the floor too?
Not directly, it's more a little bit more underneath. It's like,
the
it's
floor
right
is
after
what?
the magnus. It's pretty, it's pectineus, brevis, yeah.
And these are the
brevis is there,
femoral
too.
vein,
Artery
and nerve.
and the femoral nerve, yes.
Okay.
Right. You can't get to these guys because these are covered, but you can get to the tendons. Do you remember how we palpated the tendons? We sat down and I said, cross your leg, find your medial malleolus, okay, and what's the action of the tibialis? Inversion with some plantar flexion, and that tendon pops up, okay?
That would
So-
be the first one.
Huh?
The first one is
That's the
Tom.
first one, that's Tom, okay? And then after that, they start, it disappears, not that easy. But Tom is the most easily palpable one, and then behind it, it would be Dick, which would be flexor digitorum. So what do? We're gonna move our finger and say what? What do you want the person to do? Flex the toes. Flex the toes and you will feel it contract, okay? And if we want to flex the big toe, you go a little bit deeper and you flex the big toe and you look at, practice that on yourself. You just have to give the instruction for someone, okay?
Okay.
If we want rectus femoris, what are we gonna have them do? Extend the knee and flex the hip, okay? Right, and where are you gonna palpate? Right here, right here, okay? Okay, straight leg raise, okay?
How about the piriformis and all that? Are we gonna have that?
Well, those are deep, okay?
Iliopsoas?
And then this one
Iliopsoas,
here.
the only place you could feel it would be here, and what do? We're going to flex.
Iliopsoas?
Means not the trouble areas. Are we going to go in there?
The trouble areas.
If you get a muscle to go in there, you go in there.
No.
That's non-fly zone.
Huh?
Non-flight zone.
Not fly zone. On the ligament list, okay? On the ligament list, right here. Okay.
It's not.
Uh-huh.
You mentioned 3 of them here, right? You see? 1, 2, 3.
Okay, yeah, okay. That's,
So we have to know-
that's for review. Uh-huh. Okay. Find those here and find them there. Okay, those are the 2 ligament charts that aren't marked that we will be using. Don't forget that one.
Yeah. We take
Okay, don't forget that
We're
one.
going to go there. Just
Okay, so we see a lot of the pelvic, the pelvic ligaments, a couple of the hip ones, some of the knee here. We certainly
Can
see
we,
some
can
of the
we
knee.
go over the knee here? It's not
This,
really well.
this is not, are any of these numbers on here? No. Okay, posterior view, none of these ligaments are on here, okay, except for the lateral collateral, because that's the only one that's really good,
107?
okay? That's the only one. And the interosseous membrane, which of course, this is really knee capsule of the joint, and it's just
Not defined enough.
right. And this is really, since this is a skeleton, the muscles, these are muscles that are cut, these are the gastroc.
Gastroc.
Yeah, right.
So
So
really-
they're cut, so see, yeah, exactly, because where's it coming from? It's coming from the, oh, no, semitendinosus would be coming from here, from the, oh, I'm sorry. I'm thinking of biceps femoris, yeah, right. Semitendin, could be, but
So
anyway,
really, there's
that's
just
not even on
there's
there.
just the lateral collateral.
Yeah, it is semitendinosus.
There's just the
that's right.
lateral collateral. and
Lateral collateral in terms of ligament is good
interosseous
here,
membrane.
interosseous membrane, okay? Anteriorly, again, lateral
that's a two.
collateral, your quadriceps and patellar tendon, medial collateral, okay?
What about down
So
in the foot?
117 is what? then?
Okay, down in the foot, okay? What ligaments are on the lateral side?
On the lat, there are 3.
You've got the 3, right, so,
Tibial, fibular.
right, so you've got one,
shake it.
okay, you have them listed here, see? You've got the you call it the lateral ligaments or whatever, but individually, you just see, you connect them, okay? So this one is the posterior talofibril, because it's talus to the foot, right.
Okay,
And
112.
right, okay, so that's 112, you got 112, and then you have the posterior fibular tibiotalar. Wait a minute, okay, that's part of the wait a minute, let me see, 113. Oh, no, 113's over here. Yeah, see, that's on the medial aspect, okay, so.
Medial?
This 113 is
So
me.
tibial-
Look, this foot is like this, so this is lateral.
Tibiotalar.
Right, so it's tibiotalar, okay, that's part of the deltoid ligament, so it's really, you don't have very many on here at all, really.
Is the other foot, do we have anything about that?
Okay, now here, okay, medially, again, you have part of the deltoid ligament, okay? Tibiotalar, 112 anterior is the tibiotalar, okay? And then these guys are part of the lateral, okay, it should be. Let's see, the deltoid ligament is okay, this is deltoid because this is medial, okay, 112 and 113, that goes to the navicular, so therefore it's tibio-navicular. I mean, all you have to do is look at the 2 bones that it connects, okay, and then we really don't have we really, no, actually, the way the foot's turned, you can't really see those lateral ligaments.
But as far as
on
the
other
pelvis,
side.
there's enough,
Huh?
like, they're clear ones here.
They're
as far as the
yeah,
pelvis
it's
goes.
going to be a clear one. It's not going to be something obscure. It's going to be a clear one, the biggest ones, okay?
See, now I forgot about the name again.
Like the
Okay.
Sacrotuberous.
sacred tuberous.
Tuberous.
Okay, sacrotuberous.
Can we go to the other chart for the ligaments?
Internal oblique, just like it is over there, and that was the external oblique.
It's
Yeah,
the same here.
of course.
And
yeah.
this is the
That's
iliac
just the
crest.
iliac crest, right?
Okay.
Mm-hmm.
That's TFL? No, that's the mid.
This
that's
is TFL.
This medium glutes. Okay.
This is TFL here, and this is
Alrighty.
IT band. This is IT band.
So 25 here will be external obliques.
Absolutely, yes.
Okay.
Uh-huh,
Okay.
uh-huh, external, that's all, and of course
25.
rectus,
Right.
rectus abdominis is going to be right down the middle.
Is that a fascia too? The white.
Well, that's the fascia, yeah, that's the fascia.
Can we go to the other one?
Here, okay, we've got some knee ligaments, we've got
The meniscus.
menisci, okay, we have that, okay, we have the interosseous membrane, okay, we could see the PCL from here, can't we? Uh-huh,
Where's the
menisci.
ACL? Can we?
Well, the ACL
Right.
is coming, it's actually here,
That's it.
because
Yeah,
it's
it goes
coming
the
from the
lateral
front.
And this
Okay,
one is
it's coming.
also it's a menisci.
This meniscus, and then that's a little bit of a ligament connecting the two, okay?
This one is a
But look,
PCL.
this one, I left this on here for you, sacrotuberous, okay? And then these are the hip ones, okay? You've got the Y ligament, you know, right? And you could see sacrotuberous, again, sacrospinous, okay? And then iliolumbar, going across.
Can you point and do Y ligaments again?
Well, this is really the Y. See, like
The name
this.
is this one is iliofemoral and
And
tubofemoral.
Well,
People is the
Yeah,
small
the smaller one.
No, the smaller one. Yeah.
Yeah, this one.
Yeah.
yeah, right, from here, right. It's going
Okay.
right to the pubis.
What do you say femoral pubis? Do you give credit for that?
If you say,
You say
if you heard it.
Femoral pubis.
You have the idea, but you didn't get it correct.
What's
that
the
is.
here? This guy is here. Is that anterior sacroiliac ligament?
Yeah. If it's not very clear, we're not
Okay.
going to mark it.
Okay.
Okay. Okay. All right. Well, the circuit. Okay. All right. This is a chart. We're going from the aorta. Okay. Where's our guy? Right here. Look. We're going from the aorta.
Okay.
Okay. Here's the aorta, the abdominal aorta. It divides into the common iliac. Okay. So this is how it divides. You see? Aorta goes to the common. Oh, take that out. Take that out. Right. Okay. All right. Aorta comes down. Abdominal aorta. Remember where aorta starts, up in the heart. But then it goes, this is the abdominal aorta. And when you get to the pelvic area, it divides into the two iliacs. The right common iliac and the left common iliac. Okay, right. Now, this one just takes the right iliac, but the left one does the same thing. Okay? So we're going to follow one side. Okay? All right. And just for, even though this is the left side, we're going to follow it down. Okay? So here's. Okay, this is how they connect, okay? So you've got the common iliac, okay, and then they divide into an external iliac and a femoral. We know it becomes femoral when it gets in here, okay? So here's the artery, and the vein follows right with it, okay? So down here, it's the femoral artery, because that's the one that's in the femoral triangle, okay? And then that one divides further into a deep femoral, but we're not seeing that, okay? All right? And then as it goes down, okay, that femoral artery then swings around to the back and becomes the popliteal artery as it goes behind the knee. Okay, it's behind the knee. Okay, that big femoral artery becomes the popliteal a branch goes down there, okay? The deep femoral stays more anterior, and this one goes in the back, and that's the popliteal artery, which you can feel back here.
So, in the anterior, we still have the femoral artery, right?
The femoral artery is here, and then it divides. It divides into two, into a deep femoral, okay, and then into a popliteal, okay? All right, it divides. Okay, one goes forward, one goes back. Okay, this one goes back, all right? And then, once it goes past the knee, it divides again. And you get a posterior tibial, okay, which we saw on one of those, okay? And then you get an anterior tibial, okay? So you get one in the front, again, and a piece in the back, okay? The one in the back then goes, once it gets to the foot and goes down here, it's called a plantar artery, okay? You get a medial and a lateral plantar artery, and they join into an arch, okay? Also, it divides into another artery, which goes down the side, which is called down the lateral part, which is called the perineal, because that's where the perineal area is. Okay, so it's kind of self-explanatory the way it goes. Okay, there's not going to be a lot of focus on this in terms of structure. Okay, but you know, we've already talked about the femoral triangle, we talked about the popliteal triangle, so you certainly need to know where those vessels are, okay? And the dorsalis pedis comes from the anterior tibial, okay, in the foot. Once you get here, it's going to be right between this extensor hallucis longus tendon and extensor digitorum, right on the top of the foot right there. That's where you can feel it, okay? So I wouldn't stress about the circulation.
Okay.
You know the femoral triangle, and if you know the popliteal triangle, that's good.
No, when you get injury at the femoral nerve.
What's that?
When you get injured or damage at the femoral nerve.
Okay.
When you are going up the stairs, is what is going to be difficult.
You already saw me, don't worry about it. Already saw me.
What will be the answer? Is it going up because the femoral nerve lets you flex the hip?
That's right. Yeah, femoral nerve innervates all the flexors.
Yeah, so it's when you're going up the hip.
Including the quads,
Yes.
too. Flexors, but the extensors of the knee as well, but of course rectus femoris, okay?
Yeah.
So putting the leg up is going to be very
So
difficult.
going up the stairs.
Well,
Or what?
Yeah, you know, it's
There
funny
was
about
another-
that. It depends exactly on how things are stated, because that may be the more difficult one. See, and again, it depends where on the femoral nerve, you know, if it's at the very beginning before it gets to the iliopsoas, you know, because that's a big flexor, okay? If it's a little further down where it's in the quads, then it won't be as bad. See? But in general, if it happens early on, then that means they're all going to be involved. Okay?
So you can't go up
So
the
it's going to be
stairs?
difficult to put your leg up on the step.
Okay,
Now,
okay.
stepping down, if it's the leg that's behind you, okay, that's an eccentric contraction of the quads, and that can be very difficult too. Okay, but it's going to be hard to put that leg
Yeah,
up.
do that one again. The eccentric contraction. Say if your right leg is coming down. Let's get a look. I want to.
Down here, look, I have, this leg is doing it, my quads are doing all the work to get down here. Otherwise, I would just plop down. That's the eccentric of all the quads.
And this one will do concentric.
Well, this one's not doing anything. This could be paralyzed. I could just put it down there. You know? But once I land, I have to hold. Yeah, it's going for the ride. You're putting it down. That's what's behind going up with the good leg and going down with the bad leg, okay? Because your better leg, you know, it needs the strength